So carpal tunnel syndrome is a condition in which the median nerve of the hand, the nerve that supplies the thumb, the index, the middle, and half the ring finger, is under constant compression at the wrist in the carpal tunnel, and that leads to pain, dysfunction, and loss of use of the hand. It is the most common thing I see and treat in my practice, and it's the most common surgery that I perform, although I would estimate that only 1 in 10 patients I see that have carpal tunnel actually need surgery. The risk factors for carpal tunnel syndrome are age over 40, female gender, diabetes, hypothyroidism, repetitive motion activities such as typing or keyboarding, rheumatoid arthritis, and pregnancy. So there's several things that can be done at home for carpal tunnel syndrome prior to seeking out the help of a medical physician. You can decrease or change your activity level. You can use a brace to rest your hand. Usually we would recommend you wear those at night, but people do also wear them during the day to help rest the wrist and give the nerve a chance to heal. You can take a small dose of an over-the-counter anti-inflammatory such as ibuprofen or naproxen. If after a few days your symptoms haven't improved, you really should seek the help of a medical physician. I would recommend that you start with your primary care physician, and he can prescribe a prescription strength anti-inflammatory. He might prescribe a short course of steroids, which will help. You can have a steroid injection in the carpal tunnel, which works very well, especially in the early stages of carpal tunnel. In my practice, I also use vitamin B6. It's somewhat controversial as to whether or not long-term studies have shown long-term benefit from using vitamin B6, but in my practice over the last 15 years, I've seen a big improvement in symptoms for carpal tunnel syndrome with just vitamin B6 supplementation. If they have nighttime symptoms that wake them up and their hand is falling asleep at night more than 3 nights a week, we usually recommend that they seek out surgical intervention. The nerve doesn't have an opportunity to heal if it's being damaged to the level where either on a daily basis or more than half the week you're having symptoms. So at surgery, we need to open the ligament at the heel of the hand, the base of the hand, where the nerve enters the hand. And that's the carpal tunnel itself. And at that point, the ligament has to be opened to decompress the carpal tunnel and essentially give the nerve more room. It doesn't take very long. It takes about 20 minutes to perform the surgery. It's usually done with the benefit of a sedative and local anesthetic. Most of my patients don't go to physical or occupational therapy after carpal tunnel surgery. The vast majority are able to do exercises at home, especially during those first 2 weeks. At that point, we take the sutures out, and at that point, they can go back to all activities. Most people still have weakness that lasts another month or so. So, although they're able to do what they want, they find that there's certain things they still can't quite do. And it'll take another month or so for them to get their strength back. I had a patient several years ago that I performed the carpal tunnel surgery with the endoscope and did the endoscopic assisted carpal tunnel release, and the very next day he went out and mowed his lawn with a push lawnmower, and that activity he hadn't been able to do because the carpal tunnel syndrome was exacerbated when he used the lawnmower. The day after surgery, he used his push lawnmower to mow his entire lawn, and he said he was symptom-free.